Hello, I'm Joshua Sparrow at the Braselton Touchpoint Center, and this is Learning to Listen, Conversations for Change. To find out more about the Braselton Touchpoint Center and Learning to Listen, just go to braseltontouchpoints.org and click on Learn with Us and look for Learning to Listen in the Conversations section. There's also a link there to our archive of Learning to Listen conversations over the years. To learn more about and register for more Braselton Touchpoint Center conversations, events, and trainings, click on the learn.braseltontouchpoints.org/catalog. The link is in the chat. To join the Braselton Touchpoint Center's Learning Network, look for the braseltontouchpoints.org programs-services/BTC-learning-network link in the chat. It's in the chat. And if you are able and would like to help us continue to make programming like Learning to Listen free and available to all, please look for the donate link in the chat or the donate page at braseltontouchpoints.org/donate. Any amount, $5, $15, whatever you can do that would feel good for you and that you can do would be a huge help. Thank you for joining us. Today, we will be listening to the Bipartisan Council's Director of Early Childhood Development Initiative, Linda Smith. Linda is going to talk with us about what the midterm elections results tell us about who is listening to children and their families, and what we can expect policymakers on both sides of the aisle will and won't do on their behalf. In a moment, you'll find out why we are so honored to have Linda with us today. She is truly a national treasure, yet more humble than anyone you'll ever meet. So I have to tell you that because she won't. But first, a bit of information about today's Learning to Listen episode. Over 1,600 people have registered for today's webinar. It's great to see you all in the chat. So do tell us who you are, where you're from, and what you do there. Today, our wonderful interpreter, Maria Jose Gutierrez, joining us from Bogota, Colombia, will be simultaneously translating our webinar into Spanish. Thank you, Maria Jose. To access the translation, click on the interpretation icon in your Zoom controls. Then select Spanish. To mute the English in the background, select Mute Original Audio. La conversación de hoy será en español e inglés. En los controles de esta reunión, haga clic en Interpretación. Haga clic en el idioma que le gustaría escuchar. Para escuchar solo español, haga clic en Silenciar audio original. We are also providing closed captions today for those who would like to use them. To turn captioning on, please click on the closed caption icon in your Zoom controls and select Show Subtitle. You can adjust the size of the subtitles there. Please use the chat feature if you have a comment to share or need help with a technical issue. And please do put your questions for Linda Smith in the Q&A box, and we will try to pause a few times along the way to respond to your questions. If you would like to receive a certificate of attendance for today's webinar, and we know many of you always do, please be sure you complete our feedback survey. Now, this survey will open in your web browser when this webinar ends, and you will also receive a link to the survey tomorrow in our thank you email that will also include a link to the webinar recording. The survey and webinar recording will be available in both English and Spanish. You can also access the recordings on our YouTube channel and our website. Now, before we begin, I want to be sure to thank our sponsor, the Burke Foundation, and our Braselton Touchpoint Center production team, Isabella Mantilla, Ashley Gaddis, Michael Accardi, and Suzanne Okasik. And now I'd like to introduce today's guest, Linda Smith, Director of the Bipartisan Policy Council's Early Childhood Development Initiative. Her career trajectory reads like a history of childcare, its advances and its stuck places, over the past several decades. Linda began her career in early childhood education on the Northern Cheyenne Reservation in her native state of Montana. Subsequently, she was the director of the Office of Family Policy for the Secretary of Defense, where she was one of the primary architects of the military's child care program and oversaw dramatic and desperately needed improvements that became a model for quality child care across the United States. Additionally, Linda has held positions with both the United States Army and the United States Air Force. Later, Linda served as a legislative fellow and professional staffer on the Senate Health, Education, Labor, and Pensions Committee under the chairmanship of the late Senator Edward M. Kennedy, who was one of early Head Start's most important champions. Linda has also served as the executive director for the National Association of Child Care Resource and Referral Agencies. And it was when she was in that role that I first met Linda, maybe 15 or 20 years ago. And the National Association of Child Care Resource and Referral Agencies is now known as Child Care Aware of America. And there, Linda represented more than 650 community-based agencies concerned with the care of children in their earliest years. Key components of NACRA's advocacy efforts included strengthening child care licensing and oversight, requiring comprehensive background checks, and establishing minimum training requirements for all child care workers, all in the interests of boosting safety and quality. After NACRA, Linda served as the Deputy Assistant Secretary for Early Childhood Development in the Administration for Children and Families at the United States Department of Health and Human Services under the Obama administration. In this role, Linda provided overall policy coordination for the Head Start and Early Head Start programs and the Child Care and Development Fund. She also served as the department's liaison to the United States Department of Education and other federal agencies. And while in that role, Linda was the engineer behind the Early Head Start Child Care Partnerships, a really important innovation. Currently, as I mentioned, Linda is the director of the Bipartisan Policy Center's Early Childhood Development Initiative. Her entire career perfectly positions her to help those of us who work with and advocate for babies, children, and families to understand where we have landed just after these midterm elections of 2022 and what our opportunities are now to push forward with babies, children, and families and on their behalf as we look toward the elections of 2024. You may say it's only 2022, but it is not too soon. So Linda, thank you so much for joining us today.
Okay, well, thank you, Josh, for, first of all, for inviting me to be a part of this. I'm really humbled by it. I hope that I have some things to say to your audience. One of the things that I think is good news for starting this conversation is sort of where you landed with my bio, and that is that I do still think that there is tremendous bipartisan support for early childhood issues in this country and family issues. And I think as we walk through this conversation, I hope people will come to understand that. Having worked, as Josh said, for Senator Kennedy, I always say about him, one of the things that I learned most from him, he really defined the left in many ways in the Senate when he was there. But he knew how to get to the center, and he really lived a bipartisan life. And I think one of the things that we have to learn is how to do that in this country, is to get back to understanding that there's a left and a right, but we need the middle. So I appreciate the opportunity to talk a little bit about this, and how did we do some of those things, and where do we go from here? I think one of the things I want to talk to Josh about, talking to this group about, is sort of what are the persistent challenges that we've had already When it comes to the early childhood issue, Josh, in the correspondence that we've had before this session, talked about several programs that are really important in the Congress going forward. Obviously, childcare, that's my first and biggest passion, I would say. What's going on with the childcare workforce? Why is it so hard for us to staff these programs that we have? What's the role of paid family leave in all of this? And then there are tax policies that really do make a difference. And I'm going to talk a little bit about how do these things factor in as we move into the next 2 years of the Congress and then into the 24 elections. Finally, the Head Start always is a soft spot for everyone. And as Josh mentioned, the early Head Start childcare partnerships, and then home visiting, which is new. What I'm going to do is take a few minutes here to explain to people, for those who may or may not really understand some of this, what happens in Congress and why certain things are important. I think as a community, people looking at early childhood have been a little stuck, if you will, on sort of two parts of the process: the authorizing of the different pieces of legislation and programs, and then the appropriation process. But there's a lot more going on in Congress that people need to understand. And when I say that, it has as much to do with the congressional committees as it does with Congress itself. So how do the committees work, and why does that really matter? So first and foremost, there's a couple of things that people need to understand. And one of those is that when it comes to the authorizing committees, that's just what they do. They authorize programs. Now, and I'll explain why that matters, because, for example, the early Head Start childcare partnerships are not authorized in any language. They have simply been added into appropriations language now since we started the program in 2014.
Linda,
So-
can you, I just want to interject
Mhm.
to ask if you can explain the difference between Congress authorizing and Congress appropriating.
Absolutely. And thanks for that, Josh. Authorizing, they simply write the laws that guide how the programs roll out to the states. So in the case, for example, of the Head Start program, there's a Head Start law. It authorizes everything that has to do with Head Start. What happens after that is that every year, when programs are authorized, and there's two pots of money, and I was going to get to that, and I'll try to be as clear as I can on this. The two pots of money are the discretionary funds and the mandatory funds. And this is where it gets a little bit confusing for early childhood, because Head Start is in the discretionary side of the house. Okay, it's funded with discretionary dollars, and that has to happen every year. That's where the president proposes a budget. He puts a certain amount on his request. Congress considers that. It goes to the Appropriations Committee, and they figure out how much money they're going to give every program based somewhat on the president's budget proposal and then on their own priorities. So the discretionary money every year, and it really springs from what Congress has authorized in other pieces and in laws. So childcare gets a little bit more confusing, because childcare has both discretionary money and mandatory money. And mandatory money is what we call entitlement money. It does not have to be appropriated every year. So some of the childcare money is there for every year, regardless. But the biggest piece of it is discretionary. And then the other program that this audience might be interested in is the MCV, the home visiting program, because it is in the mandatory side of the equation. It does have to be reauthorized. As most of you know, it's up for reauthorization right now. But as money goes, the money is there once the law is passed and the money is set. It is not an entitlement, however, but it is a mandatory funding account. So that money, and this is why when the government shuts down, let's say government shuts down in December because they failed to do another continuing resolution. If government were to shut down, the McV program would not shut down because it's mandatory money. It isn't dependent on an annual appropriation. And the child care funding that is mandatory would still be there. It's the discretionary part of the child care money that would be a problem. And Head Start is all discretionary. So you see how it works. We have some that are there in different places and different pots. So these things become important when you start listening to, oh, Congress is going to shut down, or the government is going to shut down, I'm sorry. That affects some and not all. And I think that's the other programs that by way of clarification that are mandatory spending are Medicaid, Medicare, those programs. They are mandatory spending. They are entitlement programs. And that means when it's a pure entitlement program, that means that there will be enough money to fund everybody who is eligible according to the law. Okay, so that's how all that works. So it's important because all of these things are in different committees of jurisdiction in Congress. And so if let's say we want to advocate for more Head Start money, that is a discretionary program and it would go through the appropriations side of the appropriations committee. Okay, unless it's up for reauthorization. And in that case, it's under the authorizing committee. So people, but then let's go then to McV. McV, let's say we're trying right now to increase the total amount of money. Then you are working with the Ways and Means Committee in the House and the Finance Committee in the Senate. So these things are important. And I think that people understand how to direct their questions and their comments. Okay.
Someone says, wow, in the comments say, wow, I need a flow chart.
Yeah,
it's really helpful to understand this. And maybe you can say a little bit about, as voters, we vote for people who end up on these committees or off these committees.
Right.
What do we need to know about who we're voting for in terms of committees they have been, what they've done there, or where they might get to? If we're concerned about having people on committees who will ensure the funding and reauthorization of whether it's Head Start or childcare or home visiting. And someone also asked about child abuse prevention.
That's a good one. CAPTA is a discretionary program, and it is under it when it's up for reauthorization right now. It has been up for reauthorization, and not, I think I'm purely a guess here, not too sure that it will get done this year. I think they've been very close on CAPTA, but it does tend to get stuck on a few issues. So that's a really good question, though, and CAPTA is a very important program for the states. And
can you spell out CAPTA for us?
CAPTA is the Child Abuse Prevention and Treatment Act. I'm sorry. Good. Thank you for that reminder.
And someone asked about the CBCAP, Community-Based Child Abuse Prevention Formula Grants.
They are a part of CAPTA.
Okay.
And they are they come in through that door. And so if you're interested in CAPTA and it's up for reauthorization, then you would be talking to the Ed Labor Committee in the House and the HELP Committee, the Health, Education, Labor, Pensions Committee in the Senate. Okay, those are the authorizing committees. And so that's why, it gets a little gray. But
and someone asked about IDEA, which you also will need to spell out for us. But it sounds like what you're saying is we need to look at who our senators and representatives are, And you can find this online. You can look them up online. You can find out which committees they're on. And then if you know which committees are doing which authorizations, you can write to them to give your support for reauthorization or continue. Is that sort of the implication for us?
Yes, that's exactly right. And I think if you can, I think it does sort itself out. And the process, the process is pretty clear. And I can walk through what happens if this would help people. The president will submit a budget. Usually that's the last of January, the 1st of February, that the president submits a budget. It goes to the different committees, and the committees then have hearings on each of these different pieces. So in the case of like CAPTA, or no, that wouldn't be a good one, but in the case of Head Start, we take that one, or childcare. The Ed Labor Committee is the authorizing committee. The appropriations, the committee would deal with the budget. Okay, so it's already authorized. So the hearings would be held by the appropriations committee to consider, sort of what's in the president's budget. Okay, and I'm going to pause. I don't want to make this too difficult for people. And I think if we could just keep in mind, when you're asking for money, you're asking the appropriators. When you're asking for the authority to do something, you're asking the authorizers. Okay. And they're pretty careful on most of the committees not to cross over and try to, sometimes you will hear, and I want to get off of this, but sometimes you will hear that, for example, the early Head Start childcare partnerships were included in the appropriations language. They have never been authorized. That doesn't happen that often because the committees of jurisdiction really get upset when that happens. Okay. So I wanted people to understand that it's complicated, and probably would be a good thing, Josh, at some point, if we were to really, somebody said they need a graphic display, we probably could do that for people. But it is complicated, and just suffice to say, I say to anybody that I talk to about this, if it doesn't make sense, ask the questions, ask whomever is talking and get it clarified, because it is not a stupid question. It's a very complicated process, and we could muddy that up with a lot of things that happened over the last year, in particular with reconciliation, but we'll maybe get to that in a little bit here. Okay. So what I wanted to talk about after, explaining all that is, okay, so we have really, in early childhood programs across the board, I would say, been stuck as a nation. And I think we really need to give some thought to how do we move forward in this country. And I think one of the first things that I say when I talk to people about this is that we have been our own worst enemy when it comes to many of these programs, in part because we take a very narrow view of a lot of this work. So we tend to, in some ways, be working against each other. So instead of looking globally at what do families need in this country, we take each little program and focus on it for the time that it's, out there, for instance, in Congress. But we haven't looked at globally. Somebody asked me this last week, what do I think one of the problems is? And I think one of the problems is that we don't have yet, or we're yet to have, a national policy on children and families in this country. We have, and it's one of those things that I think we need to give a lot of serious thought to, because if you think globally about what families and children need, then you're going to think beyond just childcare, or just, home visiting, or just the food program, or WIC, or any one of these. We need to start thinking more globally, because I think that is in large part why we're really stuck. Okay. I think Josh, and when we talked in getting ready for this, Josh and I talked a little bit about what are some of the policy challenges that we have. And I would put one right out there, and this might make some of my friends here in Washington on the Hill not like it, but we really still lack diversity in Congress. And I think that we're getting better at it, but we really do need a diverse Congress that represents the views of the constituency and this country. And I don't think we really have that yet. We're getting better, more women, more minorities in Congress, but it's taken a while. And I think some of our members of Congress, to be quite blunt, really don't understand our young families and what the challenges are of these families. And so that's number one thing. I think we have a limited understanding of what the options are. And we tend to see everything, and this is human nature, we tend to see things from wherever we sit. But in many ways, we have to look beyond that and think about how do we expand so that we are more inclusive in all of what we do in this country. We, over the last probably decade or more, this idea of debate and discussion has completely broken down. And I think that we need to get back to where we can have honest discussions about the issues and the solutions without it becoming an attack on on anyone, whether it's an attack on a party or on a person or on a member of Congress. We just really have to have those discussions that we haven't been having. We need to see these issues from multiple perspectives. And I would say that one of the biggest problems right now in the childcare arena has been, we have looked at the issue over the last few years from the provider, those people who are running programs, and they are very important, and I have worked for them my whole life. But they see one piece of this issue. And not all parents use childcare centers or family childcare homes. They use other ways of making childcare work for themselves. And we need to have their perspective at this table. So it links me to the next thing that I think is a challenge and a policy challenge is we don't have a broad enough base of support in this country for these programs. And if you look at what happened here recently with Build Back Better, one would have thought that we could have moved that through the system, that childcare was such an issue during COVID, and so were other pieces, the whole workforce issue, the wage issue, that everyone basically gets that. Why couldn't we move the issue forward? And my basic summation of that is we didn't set a broad enough table in this country to move it forward. So if you looked at what happened for example, when the legislation first came out, there were issues and the faith community was really upset because they would have been excluded. Well, to me, we need to be inclusive, not exclusive on these things. So what happened? We lost the faith community. We lost business. And business, who needs childcare more than business in this country? And they were not there when it came time to push this over the finish line. So my next point is just that we need a bigger table. And I think it's up to everyone on this call and anywhere else, anywhere we can find that, we need to engage people in the conversation. I think that we need a better understanding of what parents want in this country. Not all parents want their child in a specific program. Many of them want to use relatives. And how do we bring them into the conversation so it isn't an either or? And then finally, we really do need to clarify the roles of the federal government versus the state government. And there are lots of policy challenges in that, with sometimes the states pointing to the federal government as a problem, and at other times the federal government saying, well, we gave them the money, that's a state problem. We really do need to figure this out. What are the various roles and how do they connect, and can't we make this work better? So I think those are the big things in terms of the policy pieces of this. And I don't know, Josh, if we have any questions at this point, or if you want me to keep going.
There are a number of questions. Some of them I brought to you earlier. A lot of appreciation for your comprehensive, systemic, global way of thinking. Lots of applause and hearts and smiles going up the Zoom screen. There are some specific questions about, for example, where IDEA is, which is the Individuals for Disabilities in Education Act, which actually Barry Brazelton was very involved in extending downwards to birth to 3. Where's that in authorization? There's a question about how long the reauthorization list is, and if and how long the wait would be for Head Start. And there's a question about the RFA grant in childcare in California, and you mostly focus on federal issues, so that may not be something you can speak to. Those are some of the sort of more specific ones that go back to the earlier part of this conversation that you might touch on. Another one that is such a widespread concern is so many early childhood providers are leaving the field. What are your thoughts about what can be done about that? I have tons of my own questions, Linda, but I'm going to hold back on them and we'll keep talking.
Okay. Let me table that question on the thoughts on the why people are leaving the field, because I want to cover that in sort of some of the thinking about, you know, in the next piece of what I was going to bring up. But
Okay.
I do think that one thing that I can clarify, IDEA, the Individual with Disabilities Education Act, is under the Department of Education, and it is through their it is reauthorized again, you know, through the regular process. It is, though, certain parts of IDEA are mandatory. Well, it's mandatory money, but it's also their entitlements. Okay. And so the difference in early childhood is that Part B is the preschool part of IDEA, and the Part C, which is the infant toddler, that goes birth to 3. And it is, generally speaking, in this country, I think in about 3/4 of the states, it is in departments of health. So we have 2 different departments managing these programs, and sometimes that becomes problematic, you know, when it comes to parents and services. And I could say a lot more about that. We happen to be an organization that has looked at this closely and would like to see a more coordination between Part C and B. Because when for a parent, the parents don't understand, let's be clear, their baby turns 3 and now they don't qualify any longer. I mean, that doesn't hardly make sense to most people, you know. So there's ways to bridge the gap with these programs, but a lot of that is clearly up to the states to do that. So, okay, so let me keep going, you know, because the next part I wanted to talk about was, so how do we bring about change in this? And I have some thoughts that I was trying to think this through about what I would say to this audience. I think what we need is, first of all, to get away from the idea that there is a silver bullet anywhere out there. There is not. And I think along with the silver bullet comes a single solution to a complex problem. And I think any problem or any program that we've talked about, the complexities are really there. So there's not one answer to what is going to fix some of this. And the more we think of it as a single solution, and especially in early childhood, I can say this because I'm in that field, we are guilty of proposing single solutions to these problems. And we need to be thinking more globally. Josh has heard me say this before. And I think that one of the more important things that I go back to my own career on, and a lesson I learned with the Defense Department program, is that we really need to focus on the child as the goal of all of our work. And I think where we've run amok lately is we have focused on programs. And the programs are important, but they're only important to the extent that they meet the needs of children in this country. And so how do we change our views on this and our approaches to it? And I think this is where I go back, as I said to Josh in a conversation recently, in the military's childcare program. One of the things that one of the takeaways after we finished working on the military program was that I had said to someone asked me, why were we successful? And one of the answers I said in response to that was that we had a system. And I sort of take responsibility for some of the systems approach, because this was back in the 90s when the military child care program was made a model for the nation. And one of the things I said was because we had a system. The reality was in DOD, we never set out to make a system. What we set out to do was to ensure that any child in any program sponsored by the Defense Department with public money was of a certain quality. And so that made us back away from certain things and figure out, okay, so if the child is going to be in a center, this applies. If the child is in a family childcare home, this applies. But in no case is that child going to be in bad quality. And I think that once you figure that out, and I think our focus in this country has been confusing at best to people. So I say, focus on the child. What's the best for the child? We'll get there. Stop thinking that the same approach is going to get a different result. I know there's many ways to say that, but for years we keep going back and saying the same things, and we're not getting there. And so how do we begin to have an approach that brings new ideas into it instead of, the same old things over and over again? And I think we've completely missed the boat on any kind of new ideas in this country. And that gets back to when I was saying, about having candid conversations and not demonizing people who disagree with you, but hearing them out and figuring out if there's something in there that we can take away. Another thing is, I said when I was on the Hill, and I've said it since then, there are three things that we need when it comes to making policy. We need data, we need research, and we need real stories. And watch any hearing and you will see that. So the real stories are either parents with their stories or programs with their stories, but we need all of those things. Now I think we have managed to get the research. We have good, solid research on almost everything that we needed on in early childhood. We are getting better at data. We still lack data on cost of these things. And we can get the stories, but we have got to think about how do we get some of these gaps that we have, and what are they and how do we fill them would be, I guess, a question. Then I think we need to stop talking about one solution, that silver bullet. So when we talk about what are the solutions moving forward here at the BPC, we talk about, okay, there are a number of things that work for different families. So for some families, they need a subsidy and they need a program. For some families, a tax policy is what they need. And for other families, they need leave. What about the families whose relatives want to take care of the children? What do we do for them? So I think if we can stop thinking about just we're going to fund childcare subsidies for all and start thinking back, what do families want from this to make their lives work, we can get to some other kinds of solutions, but tax policy, subsidies, they're all important, but no one of them is a silver bullet, is I guess what I'm trying to say to you. So let's put our heads together and figure out some other things that we can propose. It kind of gets me to where Josh was talking about. Okay, so what happens now in the lame duck and in the next 2 years with the changes that are happening here in Washington? Of course, we saw last night the elections are all done finally, and we know what we're going to be working with. Republican Congress or House and a Democratic Senate, which is always going to be a challenge. So what does that mean in terms of what may or may not get done? I think most people here in Washington would say that smaller bills are what's going to be more. We're not going to get a big reconciliation package again. We simply don't get that out of a divided Congress. So we need to think of smaller things.
And will you sorry to interrupt, will you remind folks about which legislation in these past 2 years were actually those reconciliation packages and what was in them?
Pretty much. The biggest one was obviously ARPA. And that was reconciliation.
Which stands for?
The American Rescue, might blanking on that, but
Protection.
The American Rescue Plan, something. Anyway, it was the last big package that came out of Congress, and it was not done on a bipartisan way. It was a partisan bill. Okay. So but the thing here is reconciliation as a process is complicated. Suffice it to say that it's basically only can happen when the one party controls all pieces of government, because it is purely partisan. It starts and it ends with a partisan vote. So our ARPA was one of those. The earlier bills in COVID were pretty much, they got bipartisan support. And the infrastructure bill got bipartisan support. It was not reconciliation. So, but the big package with most of the childcare money in it was reconciliation. Okay. So any questions, Josh, on that you're seeing pop up?
One which I think may connect to where you're at now, at least indirectly, is with New Mexico's new guarantee for childcare. Do you think that with some states taking those kinds of approaches, it might influence policy at the federal level?
That is a really good and a very nuanced question. For most of the country, it gets back to what is the state role in all of this versus the federal role. And the state, in the case of New Mexico, is very aggressive on this right now and very much leading on it. There are a handful of other states that are not close to what they just did, but actually taking more responsibility for childcare. Okay. But mostly not happening. And do I think that will, I wish I could say yes to that, but I don't think I can, mostly because so many of our states just simply don't have the revenues to do that. And, I wish that would be the case. And I think, for example, one of the reasons on the Build Back Better legislation, which failed, was the issue of whether states would have taken that money to begin with. There was a match required in that legislation. And even if the match was only 10% of the money, we have, I think, a handful of states that don't take all of the childcare money that has a match. And it's very little amount. So I don't see that happening. I wish.
There's another question, Linda, related to this question about what's happening to the childcare workforce. Wondering about whether some are leaving because of the implementation of universal pre-K. And I know certainly universal pre-K in states has also impacted Head Start. So I guess the question is, what role is our pre-K programs in states playing on the earlier childcare workforce? And again, I guess what are your thoughts about what can be done? And I guess what would our role as citizens be in supporting the workforce?
That's a complicated question, okay? And it's when it just leads me right where I was going. So I will move on and do a little explaining and then hopefully be able to answer that question. I think one of the bigger things that's holding us back when it comes to, you know, where do we go next with early childhood and childcare in particular, is a lack of understanding of the business model. Okay, the business model of childcare, and childcare is a business, but we need to be clear on that. And so what happened during COVID, when COVID first hit, and in some cases, the CDC put out guidance that said they included childcare with schools. Well, the last thing that childcare belongs with is schools when it comes to the financing of it, because all of the money supporting childcare is coming from parents paying for the service. So what happened, you know, obviously some states said, okay, we're closing childcare down. Then they realized, oops, we can't do that. For a couple of reasons, because schools had the money, the teachers got paid, the staff was, you know, still there, the building was there, the lights were on. Childcare, it just hit a brick wall and there was nothing. There was no money coming in. So Congress had to quickly put some money into the childcare side of the house. They did a really, really good job on that one. I always feel like Congress gets a short shrift on that. They moved quickly and got money out there for childcare. But that I think was the wake-up call to this country about what childcare is. Because I don't think most people understood the balancing act that goes on every single day in a childcare program, of balancing how much income they have against how much they have to pay, primarily in wages. About 75 to 80% of childcare costs are wages. Okay. So, and parents, we know parents can't afford to pay much more. So, you know, the programs can't pay their staff better. Okay, so that the model, the business model of childcare usually depends on a mix of ages, because infants require more adults to children than do the 3 and 4 year olds. So back to the question about pre-K. If pre-K in the state is not a community, does not do it based on the community-based model, which means you could put pre-K into a childcare program, pay the extra for the teacher and whatever you want to have done. If that's the way the state is approaching it, then childcare is fine. But if you take pre-K and put it in a public school system and pull those 3 and 4 year olds out of childcare, then what you have is a system that is, the costs go up for infants and toddlers because there's no offset in the money. So it's a real balancing act for our childcare providers in this country. So when people say deal with we have to deal with the workforce compensation, I get a little frustrated with that, not because I don't agree, but because where is the money coming from? If we're going to pay the teachers more, you either have to raise the fees to the parents, or we have to figure out some way to fund the delta between that pay and what parents pay. And that, by the way, was one of the things that we figured out in the Defense Department, and why I think that system has maintained. And that's because We put the money, the public dollars for the Defense Department go into the program. We give the programs a certain amount of money. In exchange for that money, they have to keep the fees down, but they also had to increase the pay and the training of the workforce. So the wages went up, the fees stayed down for parents because the money went into the program. And one of the, what I think would have been challenges with Build Back Better was all of the money would have been going into what I call the demand side of the equation. In other words, giving parents a voucher to go buy childcare. That doesn't create stability in the programs, if that makes sense to everyone. And so it's a complicated process, but we need to figure out how we support the supply side as well as support the parents. And it shouldn't be either or. And I think what we have done is get ourselves into a conversation about it's either over here in the parents and parent choice, or it's, we're giving it to programs and creating, something negative.
And that
So,
goes back to what you were saying about how the silver bullet search gets us in trouble, because if you just do one thing, it's not going to work because you need these things to work together, the supply
exactly.
side and the demand side. And just to recap what you were saying, you also need policies that allow programs to take care of 3- and 4-year-olds who require less staff,
Right.
as well as infants and toddlers who require more staff, so that they can balance out their costs that way. So there are, already 3 different elements of an approach that goes way beyond a single silver bullet. And this is part of why you want us to get to the center and talk together and listen to each other, so that we can put together the different pieces, since some of us may be more attached to one or the other. So you say it's complicated, but I think I'm getting it now.
Well, it is complicated, but I mean, but not really. When you really think about how a business operates, these are businesses, and that's essentially, when a business has a product to sell, it has to be affordable to the people who need it. And in the case of childcare, it's not, unless we figure out how to do something with the supply to underwrite the costs of it. And I say quite frequently, and I'll probably get myself in trouble for saying it here, we figured out how to make sure that the food supply in this country doesn't fail. Or, we figured out how to make sure certain things are in our society when we need them. And we need childcare, and we need to figure this out. It's that simple. And I think we came closer to understanding this because of COVID. And when these businesses started to fail, it was, oops, we really do need to move in here and put money into these programs to keep them alive. The only way we're going to ever raise the wages of the workforce is to figure out how to get that money into the supply side. Okay. And that gets back to the question that was asked here, was that, how are we losing teachers to other? Yes, we are. We're losing teachers to schools. We're losing them to pre-K programs from the childcare side. We're losing them to Target and McDonald's right now. And so the workforce is almost a crisis situation in early childhood. In my conversations with most of the big providers around the country, they say it's twofold. They're not just losing their teachers, they're losing their best teachers and their most trained teachers. And I think that's why we need to really think about this, and what are some solutions that would create this balance between the supply and the demand in the country. So anyway, that's why the workforce is poorly paid. One could ask, and as I was thinking about getting ready for this, one could ask, so what gives with the Head Start teachers being poorly paid, or even in the case of home visiting, sometimes home visitors don't get the pay they need. I'm going to probably, again, some won't like this answer, But the truth is that it's up to the grantee to determine the wages of the people that
The
they
Head
are.
Start grantee.
Yes.
Yeah.
And I said this when I was in at HHS. The grantee can raise the wages of the teachers. They have to negotiate their contracts, or their grants with HHS. But we were very supportive of saying, yes, we need these teachers. We're now requiring degrees and we need to pay them appropriately. If come in and ask us and we'll renegotiate your grant.
So
so-
in our, sorry, go ahead.
No, go ahead.
Just in our last couple of minutes, there is a question about the point you made about we won't get through major pieces of very costly legislation. So what would the smaller asks or smaller bills be that you would encourage us to get behind is your final call to action for us?
I think the final call to action is to be thinking about where are there, first of all, in because of the divided government, we know that the conservative side of the aisle is more interested in tax policy. So what kinds of things could we do with tax policy in addition to the CTC, the child tax credit, which helped a lot of families move out of poverty in this country? There are a number of ways to get families income, or get childcare out there. So we're looking at tax credits for businesses who help their employees. What kinds of ideas do people have on tax policy? Because I think that is going to be one that gets a lot of attention. Okay. We know we have facilities problems. We lack infrastructure in this country. What can we do that wouldn't be a huge lift to get some grant money out there to build and improve the facilities around this country? We've had bipartisan success in previous Congresses in getting legislation introduced in that. So those are the kinds of things that I think we should be, at least in this early on stage, focusing more on tax and that side of the aisle. We definitely need to fix the funding, but in order to do that, Josh, we just need the data. One thing I would say is going on if those of you are on the call don't know, there was a bill introduced in the House last week by Congressman Owens, a Republican, which is calling for states to do cost modeling. In other words, we have to figure out the costs of all of this before we can put any solutions on the table. And I think the Murray-Scott bill, it included a requirement for cost modeling, cost centering, as did the Burr-Scott bill in the Senate. So we've got both sides of the aisle now agreeing that we need to do a better job of understanding the costs of all this before we can move forward. And I think that's another place where we can, as advocates, you support these things. Let's understand what it costs before we try again to put a big bill through. If that
And
makes
I think your Bipartisan Policy Center is doing a webinar soon on
we just
exactly.
did. We just did this week.
And
and-
the recording is probably available on your
Yes.
website, right? Yeah.
Yes. And it explains the business model for childcare in great detail and why we need to sort of, to figure this out, why we need the costs. We need the cost of the system at the state level, the cost of a program, and the per child costs. We don't have those.
I could listen to you for days on end, and the knowledge that you've shared with me and with all of us is power. And I think you've encouraged us all to use the knowledge you've shared as power. And I want to thank you, Linda, for having taken care of the children of all of those men and women in the military who have protected all of us. And I really see you as having taken care of our nation's children for your entire career. And you'd never toot your horn about that. But I think people need to know, who you are and what you've done. I am so grateful to you. I'm so grateful to everybody who's joined us today. I see lots of friends and advocates commenting here who are also doing this important work. Thank you all for joining. Come back soon. And please do take a look at the brownstontouchpoints.org website for upcoming events and conversations, including our National Substance Use Disorder Summit on February 1st. And please do also take a look at the website, brownstontouchpoints.org, if you're interested in joining our learning network, and if this program has been meaningful to you, and it would be meaningful to you to be able to support our work with a donation of any size, no matter 5 or 15, whatever feels good and right to you. Thank you again, Linda. Thank you all again for joining us, and we hope to see you again soon.
Thank you.